My name is Dr. Charles Machira. I'm the Medical Services Manager for Zambia Sugar. I've been working for Zambia Sugar for the past 17 years. That's a long time, okay? Before that, of course, I worked at UTH. I worked at Mazabuka Hospital, both at district and the hospital level. I worked at Choma district, both hospital and the district, and the Livingstone. I was the executive director of Livingstone General Hospital, and at one time I also worked as district director of health for Livingstone. So I know Southern Province very well. Okay, so I came here, of course, 17 years ago as a medical services manager. We have one hospital here, which is Zambia Sugar Hospital, where we are, with a capacity of about 30 beds. We do, of course, have both pediatric and adult admissions. Apart from providing primary health care, we actually do provide specialized clinics, which include HIV and AIDS care, hypertension clinic, male circumcision, antenatal, postnatal care, among them. And we also provide referral services. Where we are not able to provide a service, we do provide referral services. Is to make sure that we treat our employees and they get back to work in time. And I think we do provide quite a very, very good service. And we feel by so doing, we actually save time. That employees are supposed to be home instead of being productive, working in the factory or agric area. So that is our key contribution, and you find that our man-hour losses due to illnesses are quite very, very low because we provide a good service. Apart from the primary health care and the other things that I've spoken about, I think we do provide occupational health. We want to make sure that when our employees come for work, they go back home the way they came. So we do audiograms, we do vision testing, we do testing for chemicals like heavy metals, we do lung function tests, and I think we are among the few businesses in this country which actually do quite a lot in the area of occupational health. And we have a good diagnostic service as well, where we run most of our tests here on site. We can actually initiate patients on treatment, whether it's TB or HIV here, without needing to refer them elsewhere for investigations. I don't know if I have already mentioned the fact that our population is about 18,000. Of course, the people that we attend to are slightly more than that, because there are people who stay off the estate, like myself, who are not part of that 18,000. And we attend to private patients. There are patients that would want to get a premium service, and I think we do provide that service here in Mazabuka. So apart from this clinic, the hospital here, we have got 4 other clinics. We have got Nanga, we have got Kambika, we have got Kalea, and we have got Chula clinics. We don't do admissions in our peripheral sites. When they require patients to be admitted, they come here. That's where we admit them. I think briefly that's what we provide at Zambia Sugar.
That's very awesome.
Thank you. We provide public health, and our key focus in public health is water and sanitation, disease surveillance, and we emphasize so much on malaria. I think we can proudly say we don't have malaria here. When we have cases of malaria here, most likely they're imported cases. We get them usually when schools are closing or weekend farmers who go out farming, then they come back. Usually we're able to trace, to say actually this case started from here, because we don't have malaria at Zambia Sugar. We don't. The few mosquitoes that we have are not malaria carriers. And when we go to the pharmacy, you see that maybe we only have maybe 10, 12 courses of malaria drugs, because we don't use them. Most of the time when we use them is when cane cutters are coming in from off crop, that's when we use them. Of course, when we had the challenge of COVID, I think we did quite a lot. I think we are one of the few companies that procured ventilators. We procured 2 ventilators for our employees here, and we designated a site where we could manage all our COVID cases, and the outcome was quite good, because at that time I think the best drug on the market was Remdesivir, and we bought that for our employees. Until this time when we actually had to donate it out, when we saw that we're not using much, and we had to donate it out, and it was quite expensive to actually use that drug on employees. So we did very well in the area of COVID as well. We are doing very well in the area of HIV. And you see when we go to the ward, most of the time we don't have any patient because our people are healthy. We are doing a good job. We are managing them as outpatient. So a few of them will get to the ward, and when they get there, I think we manage them very, very well. We don't have a patient on this ward. Florence, please come. Florence is the one running these wards, and we only have one patient at the moment who is on the ward. And just as I said, we used to have 4 beds. So once the malaria issue was sorted out, once we started managing our HIV cases, this is where we've got to. I'm actually getting worried that one day I'll have no job because there are no patients here, you can see. Yeah. But this is also a good sign that we are managing the problem somehow, Yeah. Sister Kuflum. Sister Ndiwe is our occupational health nurse. She will just explain what we do in this office.
Good afternoon, everyone. You're welcome. I'm Lindy Obanda, the occupational health nurse. So in this office, basically, we look at the pre-employment medicals that we do. So we have the pre-employment, where the employees are coming, the entry medicals. We also do the periodical medicals as well as the exit. So in this office, basically, we do 3 tests. We have the audiograms, or the audiometry test that we do in this booth for our employees that are working in noise areas in the factory. And then we have the vision tests, which we do on our drivers. So before the drivers go on site, we need to make sure that their vision is good. And then we also have the spirometer we do on our patients, the employees that are working in the factory, the welders. Yes. And the other things that we do, we also do surveys, the noise surveys, the light surveys, the heat survey, radiation survey. And then we also train first aiders. So we have a lot of first aiders in the factory and just around the organization.
Their files from, their medical files. While they are waiting to get the files, they sit here. At times we do provide the health education just here, while people are waiting to get their files. Once their files are collected, then they go to the next point, where they meet the physician. And we have an emergency room, of course, here. Emergency cases come straight to the emergency room. You can see here. So once patients are seen here by the clinicians, they are either referred to go and see the doctor, or they will be sent to the lab to go and collect their medication, or they will go to the lab. So this is our laboratory. Ivy is the one standing in for the gentleman in charge of the lab because he has got a bereavement in the family. So we do quite a number of tests here. We do hematology, we do microscopy, we do biochemistry, and we run quite a number of biochemistry tests apart from the ones, the normal liver function, we can do other things as well. And where there is need, we are actually able to do culture as well. And we are also a blood transfusion center. So if we have a situation where we need to transfuse blood, we are able to do it here. So most of the basic tests that we require to make a decision, they can be done here. We have most of the things that we require to manage our patients. Yeah, we do.